The Panadent Ear Bow is simple to execute but requires some attention to detail. This procedure is necessary to be able to articulate casts to the Panadent articulator. It is also a necessary precursor to performing an axis bow transfer if a hinge axis articulation is the goal. Shown here is the instrumentation necessary: a foam horseshoe to be applied to the mandibular side of the bite fork and 3 compound bite tabs to be applied to the maxillary side of the bite fork. Also shown is the bite fork with the midline indicated and the Panadent logo up. The scissors are to be used to cut the foam, and of course a mirror is needed to retract and to observe. Lastly, a torch and stick compound is needed. An optional accessory for the ear bow is the level. Using this aligns the horizon of the articulator with the incisal plane of the teeth. This allows the laboratory to more effectively maintain the aesthetics of the patient. To begin the procedure, Panadent compound buttons are placed on the bite fork. It is important to place the compound bite tabs on the maxillary side of the bite fork with the Panadent logo and the midline facing up as shown here. Sometimes, if the arch is partially edentulous, these buttons have to be positioned to line up with the teeth of the individual patient's arch. As a substitute, compound can be placed in lieu of the buttons. However, an adhesive must then be applied. Once the compound bite tabs are in place, it is a simple matter to heat the tabs and insert in the mouth, indexing the compound with the maxillary teeth. It is important that the index marks make an impression in the compound and the midline be in proper position. It is critical not to have the teeth touch the metal part of the bite fork. Shown here, plenty of space lies between the teeth and the metal. Next, gauge the amount of clearance existing between the lower teeth and the bottom part of the frame. Generally, because the mandible closes on an arc, the posterior teeth are going to contact first, leaving a gap anteriorly. This gap is to be filled with the foam horseshoe seen earlier. Place the horseshoe over the bite fork and note an overhang as seen in the video. Use the scissors to cut off the distal extensions and save. Once the ends are cut off of the horseshoe, remove the paper backing and attach the horseshoe to the mandibular side of the bite fork. Try this assembly in the mouth, noting how much clearance is created between the mandibular anterior teeth and the bite fork. Decide whether one or both of the little squares you saved are going to be needed to create a stable tripod. Peel the backing off of one of the little squares and place in the anterior region of the horseshoe. Return to the mouth and have the patient close firmly. In this instance, only one square was needed. The critical point behind this process is to make sure that the bite fork and the head actually move in unison when wiggled, and the bite fork does not separate from the index marks on the maxillary side. The best description would be to liken it to a dog with a bone and the dog biting very firmly so that the bone does not move in the dog's mouth.